In Fox 5 Health News, Merck says that its long-term study of Gardasil found the HPV vaccine is still protecting girls and boys 10 years later without any serious side effects.
All right, joining us now, Dr. Serge Sugar, Chief of Infectious Diseases at Holy Name Medical Center. All right, doctor, walk us through exactly what this study found.
Yeah, so thanks for having me, guys. This is a long-term follow-up study over 10 years, recently published in the Journal of Pediatrics. And it found and addressed a couple of issues. One is the idea of safety. There were no what we call SAEs or severe adverse effects or deaths associated with the administration of this vaccine. The idea of efficacy, it was extremely potent in preventing HPV-associated diseases and cancers like cervical cancer, anal cancer, vulvar cancer, or even HPV-associated warts or oropharyngeal cancer, or head and neck cancer. And finally, it was a sustained response over a long period of time.
Yeah, so this is certainly good news. And kind of talk about the reasoning behind this and why it's so important for young boys and girls to get this vaccine.
Yeah, so great question. So first and foremost, it should really put parents who have these decisions for their teens at ease in terms of when they make this decision. But the reality is 47,000 cases of HPV cancers occur every year. So this really underscores the importance. It's really a public health emergency because these are, when I see them as a physician, these cases, they are highly preventable by utilizing this vaccine. So again, cervical cancer, the fourth most common cancer in women, anal, vulvar cancer, and head and neck cancer, which can be really devastating. And especially when you think these are preventable, it really puts this public health issue at ease or at light, and really underscores the significance of administering the vaccine.
No, absolutely right. It's a vaccine that can prevent you from getting cancer. Yeah. No, it's pretty good news for sure. Now, we would like to point out that Gardasil has not been without controversy, including lawsuits that claim the vaccine can cause cervical cancer. Merck tells us the overwhelming body of scientific evidence, though, continues to support the safety and efficacy profile of our HPV vaccines, and they will vigorously defend against those cases. Well, Jimmy Buffett's website reveals that the singer died of Merkel cell carcinoma, a rare and aggressive form of skin cancer, and one that most people likely had never heard of. Doctor, I know I hadn't when I saw that sad news. So what exactly is this cancer?
Yeah, sure. It's a type of skin cancer. I think most people have heard of melanoma. So it's like a melanoma on steroids, if you will. It's 3 to 5 times more aggressive and deadly. It's very rare, as you alluded to. Only about 3,000 cases are diagnosed every year. Now, of course, what are the risk factors people want to know? It's still unclear. A lot of what is known about this cancer is unclear. There's probably an association with UV radiation and light. So, of course, we all, myself included, being a fan of Jimmy Buffett, know that he sang about the Gulf Coast lifestyle, so probably had a lot of light exposure from a light age. But there's other factors in play, maybe genetic, maybe immune, maybe associations with a specific type of virus. So there's a lot of different etiologies that may be at play here. But the fact remains it's a very rare type of skin cancer, very deadly, much more deadly than malignant melanoma. And the treatments are not that great. There is standard chemotherapy, radiation therapy. Sometimes doctors may use immunotherapy. That's where they actually stimulate the body's own immune system to attack cancer cells. Oftentimes patients are put in clinical trials. The key here is really early diagnosis. About 75% of the time, if early diagnosis, you can have a survival rate up to about 5 years. And we understand Jimmy Buffett was battling this disease for about 4 years before his untimely demise.
Yeah, good awareness there. All right, doctor, appreciate you coming on. Thank you so much.
Thanks for having me.